Continue this conversation now and get a sense of what is happening on the West Coast, especially as Governor Gavin Newsom is making moves to reopen the state of California. We're joined now by Dr. Jennifer Ellice. She's joining us out of Los Angeles. So, Doctor, how would you describe what's happening on the ground in California right now? As you're seeing it inside the hospital, have we turned that corner?
Thank you for having me. Yes, absolutely. There's a lot of optimism right now. I just got off of a shift late last night, early this morning, and in my 10 hours, I didn't see a single case of coronavirus. Our positivity rate now is about 1% in California, and we are very cautiously optimistic that we are going to continue this trend long enough to get enough people vaccinated.
That is such great news, Doctor, and definitely what we need to hear. But, just about a week ago, we had the head of the CDC talking about impending doom coming, that there's going to be this fourth wave. Do you think that the state of California might be able to avoid that doomed fourth wave altogether?
Well, there certainly is concern because we've been in this position before where we saw the East Coast get hit a lot earlier than we did. And certainly a lot of us were taken by surprise in December. We had one of the worst outbreaks in the nation. So we are optimistic, though. The difference this time is the vaccine. And as of today, I believe close to 20% of people in California have had at least one dose of the vaccine. And it's important to remember that even with all the concern for variants that you guys mentioned earlier, that some limited studies have shown that vaccinated people who are exposed to these variants, the few cases where the variants have escaped the immune system, when people are vaccinated, they still manage to avoid serious critical illness and death. So we are right now in the middle of a very critical period where if we manage to get enough people vaccinated, then we might be able to continue this trend and avoid the fourth wave.
So, Doctor, I hear what you're saying, that it is essentially a race, vaccines versus variants and virus. Considering that we're about 8 weeks out from that target date of June 15th for reopening, then given where we are right now and where California is right now, at least in that vaccine race, is reopening on June 15th too early, too soon, or just right?
I feel as though people are already reopening. From what I've seen on the ground, people are already gathering. There have been some lax enforcement of social distancing. So it seems to me that it is prudent, especially if we manage to continue vaccinating at the rate that we are right now, to open completely by June 15th. And in some cases, it's people are already acting as if we are open. The main thing that's going to determine whether or not we avoid the fourth wave is whether or not people continue to practice mask wearing and social distancing. And I can't emphasize that enough. Until we have enough people vaccinated, that's really the most effective weapon against the continued spread.
Right, and to remain wearing those masks and social distance, even if you have been fully vaccinated. On the question of these vaccine passports, this has sort of become a political football. A lot of people are saying that it's going to be really tough to mandate that, especially at the federal level. But we are seeing some businesses now saying, you're going to have to show proof of vaccination in order to either come into a stadium, perhaps go on an airplane. Without getting too political here, Doctor, do you think that a vaccine passport should be closely considered? I mean, I would imagine it would make your job there at the hospital in the ER a lot smoother.
Yes, I mean, you can completely understand how a vaccine passport would really help people make smart decisions about what to do. I mean, if I were going to get on a cruise right now, it would really, I would be very reassured by the fact that everyone had a vaccine passport who was on the boat with me. So you can see how this would make a reopening a lot smoother. The concern, of course, is whether or not there would be a national database where the vaccine passports could be verified, because the question is, we have the data. The CDC already knows, that we have in some cases, the data is masked, but whether or not people have been vaccinated. The question is just whether or not we are going to facilitate a digital database that is easily accessible with apps that anyone could have on their phone and use. I have to say that I'm not terribly optimistic because of the political considerations that you mentioned earlier. But in some countries like Israel, where they've already established this kind of database, it's gone very smoothly. And it's really greased the wheels in terms of reopening the economy.
Doctor, anecdotally speaking, when would you say that, okay, great, we've made it through this. We can see our friends, we can see our loved ones again. We don't have to worry so much about social distancing, don't have to be so stringent when it comes to the mask wearing. Is that when you just mentioned a little bit earlier, you didn't have any COVID patients that came in last night? Is that when you haven't seen any for a month? Is that when no one has died in the hospital from the disease? What is a doctor, on the ground? When do you say, I think we've actually made it through this?
That's a very good question, because I think personally, and the CDC agrees with this, if you are in a room with people that have been fully vaccinated and are 2 weeks after their last vaccine, then you can feel comfortable relaxing and taking your mask off. But until a significant portion of the entire planet is vaccinated, unfortunately, you can't completely let your guard down. And I think, especially when it comes to travel, the issue with the variants is that not only are we concerned about the current variants that are circulating, and you mentioned the B117 vaccine variant earlier, but you have to think about the variants that we don't know about and that are sprouting up right now all over the world. And the variants are able to occur when the virus mutates, and the virus is able to mutate when you have a large portion of the population that is not vaccinated or not immune. So as long as we have countries like Brazil, as long as there are places where the virus is left unchecked, we have to maintain concern that there could be a mutation that would escape the vaccines. And so until I feel like I can see a significant the world vaccinated, I would not feel comfortable, completely relaxing.
All right, Dr. Jennifer Ellice, ER doctor based out of LA. Thank you so much for all of those insights.